unfortunately have a disease which is going to affect their kidney. And for that, we certainly really need to raise more awareness. And while we speak of it, the theme this year around is kidney health for all. And we really need to kind of make sure that we spread that awareness which is being required when we speak about significance of this day, importance of this day, you know, the impact on health of the people who actually suffer from diabetes, hypertension, how come hearing loss is actually in connection with the kidney as well. I think with all of these questions, we would like to introduce our wonderful worthy guests who happen to be over here. Both of them happen to be professors, but obviously they certainly didn't wanted us to kind of go beyond that. So ladies and gentlemen, we're very lucky that we've been joined by somebody who happens to be a consultant nephrologist. He is Professor Dr. K.H. Mujtaba Quadri. Hello, sir. Assalamu alaikum. Good morning. How are you?
Wa alaikum assalam wa rahmatullahi. Thank you for having me.
Thank you so much, sir, for joining us. Wonderful to have you over here. Not just that, ladies and gentlemen, alongside Professor Dr. K.H. Mujtaba Quadri Saab, we're very lucky that we've been joined by Professor Dr. Zahid Nabi Saab as well, who happens to be from Head of Nephrology, KRL. Assalamu alaikum, sir. Good morning. How are you?
Thank you very much.
And while we speak about it, obviously, Mujtaba Quadri Saab is going to represent Maroof Hospital over here. We're very Maroof Hospital and KRL Hospital has been really kind to let their doctors go on that too on such an important day. But sir, your role over here is to make sure that you spread that awareness which we have been talking about. First things first, how would you want to highlight the importance or significance of this day, where today we come together and, you know, while we speak about this day, it's the International Society of Nephrology and International Federation of Kidney Foundation who collaborates to make sure that we observe this day. So please, let's get started.
So thank you very much. Bismillah ar-Rahman ar-Rahim. The World Kidney Day obviously highlights several issues that are related to predominantly the patient community. And I think it's important to serve as their advocates. And since about 2 decades, this day has been celebrated. But this year, the theme in particular, every year there's a different theme. So this year, the theme in particular is about living well with kidney disease, taking care of the vulnerable, and also preparing for the unexpected.
Exactly.
And if you talk about the unexpected, COVID-19, there was nothing more unexpected than that in the last century.
Right.
And so, again, COVID just simply highlighted the inadequacies and the disparities in our healthcare delivery system, where people who obviously were dependent on certain systems suffered a little more than others who were more privileged during these times. So what's important to highlight is that kidney disease does not spare presidents or paupers. They affect everyone equally.
Right.
And one needs to have a system where this group of patients who are, you know, they feel they are vulnerable, they feel they're economically challenged, families are economically challenged, transplants are expensive, dialysis is expensive, medications are expensive for taking care of chronic kidney disease. So we really need to have some kind of a system within the country which supports them and subsidizes the care of the
And we'll definitely talk about it towards the end of this segment, but let me very quickly move on to Dr. Zahid Saab over here as well. Now, Dr. Saab, you know, this is something which I was discussing earlier with Qadri Saab as well, and that is that, imagine, so Allah has given us life worth 80 long years, right? So obviously all the organs which have been designed within a human body really need to stay with us till 80 years or 70 years, or Allah knows for how long we're going to live. Why do you think that, you know, that the kidney is being impacted because of our lifestyles? Or do you think that the choices we make, or what we eat, or what we breathe? So please let's talk about it.
Yeah, I think, you know, because the basic function of the kidney, we should know what is the basic function of the kidney. The kidney is responsible basically to clear the waste products from our body. That is one. The other thing is the control of blood pressure. Every second, third person is hypertensive. That is also, the kidney is mainly involved in that. And at the same time, your question, what you said is that how we can make ourselves fit and make sure that our kidneys should work properly.
True.
The most important thing is that you should know that if you are vulnerable, you are at risk for kidney disease or no. That is very important. Like if you are hypertensive, if you are diabetic, if you have a family history of kidney disease, you are obese, you are smoker. So this means you are prone to kidney disease, you are at risk for kidney disease. So the old saying that prevention is better than cure, then you have to take care of yourself.
True.
By taking care of yourself, what I mean is that obviously you have to keep fit, regular exercise, no smoking, and weight. Obesity is a very, very important risk factor for kidney disease. Not for kidney disease, the metabolic syndrome, diabetes, hypertension, everything is related to obesity.
True.
So you have to take care of your weight very well. You have to control your blood pressure. If you are diabetic, you have to meticulously control your diabetes, and these are the risk factors which you can modify.
Exactly. And in addition to that, Dr. Saab, I would want you to kind of explain that how do we kind of burden our kidneys that we reach to a point where unfortunately we're involved in a chronic illness, that too, which relates to kidneys as well. Do you think that it's the protein intake, because we go to the gym, we take protein powders, we eat mutton, beef, that's what we love over in Pakistan. You know, there's so many dishes. We especially travel to Peshawar to have that namkeen kadai, you know.
Yeah, obviously, you know, the food habits, the intake of protein, excessive protein like these energy drinks and these protein powders, they do harm the kidney. They do harm the kidney, no doubt about it. But the main thing is that if you have an underlying kidney disease, then this harm will be multiplied.
Okay.
So if you have a definitive kidney disease, then there is a definitive renal diet which you have to comply with, so that there should be no extra burden on your kidney.
Okay.
But just if you are eating well, and like you are eating well and you are fit enough, then there is nothing wrong in taking this namkeen kadai.
Thank you so much. Thank you so much. It feels so wonderful, you know, and for everybody who's out there as well. But moving back to Quadri Saab away, I think, you know, you have a question you wanted to ask.
Yeah. So, sir, stone disease is a common cause of, you can say, chronic kidney disease. How can it be prevented? And also, I want to know about the initial symptoms of the disease.
Okay, so, you know, I think it's important to understand what makes a stone.
Yeah.
So, in general, that if something, any fluid like urine, if it gets super saturated with certain solutes, and there's a certain medium with low fluid in there, like the, you know, the density or the concentration of those solutes is too much, and the fluid intake is less, or if you have certain inhibitors of crystallization, or there's a certain pH change in the urine, then certain kind of stones will precipitate in the kidney. So there's a lot of predilection for people within families. So there may be a family history, the stone belt in Pakistan, Sindh, Multan, southern Punjab in particular. So I think that is important to understand, that there is a family tendency. There could be, you know, obviously the diet contributes to it. So people who have a tendency for stones, who take a high salt diet. So what happens is that, you know, the salt gets reabsorbed and calcium gets dumped in the urine. So people then who have a high oxalate intake, things like tomatoes or, you know, palak, things like that. So obviously they'd be a little more susceptible, especially with a high protein intake burden. Again, things which are rich in phosphorus would contribute to that. But the essential thing is, if you can keep the urine volume high, like, you know, by having 2.5 to 3 liters of fluid, and having around 2 liters or a little less of urine output, then in general that supersaturated state is inhibited. But some people are born with certain inhibitors of crystallization, which are absent or deficient. We find in our practices, I think Zahid would bear me out, hypocitrate urea, less citrate in the urine is so common, that I almost feel that, you know, maybe our normals are different. I'm not even sure if that's a pathogen in Pakistan. But those are the kind of factors. So people need to understand that if you have a family tendency, volume, high fluid intake would be at least the one single thing, if one had to name, that is important to
And if you allow me, sir, I think, you know, the most important thing which I have felt in my practice, and sir as well, probably if someone has stone, they are going to a urologist, which is a kidney surgeon. They are managing the stones, either doing surgeries or whatsoever. But what sir has mentioned is very important, that you have to find out the cause of those stones. You know, sometimes there is genetic tendency, yes, sometimes there is hormonal imbalance. There is one hormone, parathyroid hormone, that is sky high, and that is forming stone.
Sorry, I'm cutting you, sir. Do you think that our food intake, the kind of lifestyle we are living in, that also leads to the development of kidney stones?
Yeah, as Dr. Quadri mentioned, you know, so if you're not taking enough fluids and your food is rich in tomatoes and oxalate and all those stuff, But what I want to emphasize is that what I have observed, patients have they are recurrent stone former, but no one is paying attention why these stones are formed. Like simple thing, citrate in the urine. People have low citrate in the urine, that can be easily managed, and so that the stone formation can be stopped. So I think for everyone who has a kidney stone, apart from seeking advice from a surgeon that to get rid of that stone, that's fine if they're causing mechanical obstruction, but they have to work them up why they are forming these stones. That is very important.
Exactly. And, you know, sir, since you've touched upon this as well, you know, so for more further awareness for our audiences out there as well, let's just kind of define about or talk about a urologist and the difference in between nephrologist as well, because, you know, because we're talking on a World Kidney Day as well, so let's kind of have that explanation as well?
That is very important question. You know, the urologist is simply a surgeon who is dealing with the kidney issues.
यानी मरीज
The
जाएगा तो
surgic-
कहेगा बस आपको ऑपरेशन ही होना अंदर है.
I mean, stones and all the surgical procedures regarding kidneys and urogenital system is being done by the urologist. And nephrologist is a physician of the
Physician,
kidney.
okay.
So there is distinction. There are many diseases which are overlap. Obviously, you need a urologist and a nephrologist, but there are few diseases which
True.
is the domain
so
of a
who do you
nephrologist.
think can figure out the root cause wonderfully well? Is it the nephrologist or the urologist?
Obviously, the nephrologist.
Obviously the nephrologist. All right. So, and that should always be the first place to go to, you know, God forbid if you have any issue and if you know that, God forbid, it's your kidney which is hurting. Ladies and gentlemen, the first person you really need to go to is a nephrologist, and then they will tell you, God forbid, if you need a urologist or not. Am I correct?
I think it's better.
It's better,
because what I feel that there are so many complex diseases. A nephrologist is a better oversight than a surgeon. The surgeons, they are more mechanical, you know.
I think that's wonderful. Moving back to Qazi Sahab over here. Now, Qazi Sahab, when we speak about chronic kidney diseases or illnesses, God forbid, what are the most common? So we've spoken about Patri. What are the other diseases or illnesses?
So, I mean, like worldwide, it's diabetes. I think that's the biggest scourge of our current time. So, in terms of non-communicable disease burden, as diabetes goes up, so 50% of your type 1 diabetics and about 25 to 30% of type 2 diabetics are eventually going to have some form of kidney disease involvement. So, diabetes is a major one, but besides that, what is unfortunate in Pakistan is this category of chronic glomerulonephritis. So, these are chronic glomerulonephritis. Even I have a difficulty saying that. But the important thing to highlight that is that a lot of kidney diseases which are treatable are missed in our primary care system and in our general practices, because early detection of kidney disease which is so important in terms of detection of protein in the urine beyond a certain limit, or blood in the urine, and early symptoms of kidney disease, like, you know, not being able to concentrate urine and having a lot of urine in the middle of the night.
True.
Those kind of things are subtle things which get missed, but those are the things that are important to pick up at the primary care level. So anybody who's taking care of diabetes or high blood pressure needs to be doing urine analysis routinely, taking care of the creatinine. Even creatinines in Pakistan are very misleading in the lab ranges that we see.
True.
A lot of people are saying that up to 1.4 is normal. I'm sorry, that's very, very high for a lot of people. Maybe for a person who's got a big muscular mass like yourself, 1.3 might be, mashallah, normal. Yet, if somebody is, you know, maybe 50, 60 years old and half your size and maybe female gender, that 1.2, 1.3 is like, you know, having stage 3 chronic kidney disease, less than 50% kidney function. So it's important to understand these particular things.
And sir, since you happen to be the chairman for the research task force in the Pakistan Society of Nephrology as well, so how do you think that you're going to cater this menace? Because I've come across this situation quite a lot of times where the scales have been, you know, probably, you know, the FDA or, you know, it's the pharmaceutical companies, they will take them up, bring them down. You know, they play accordingly. So, you know, earlier, because, you know, my father always keeps a check on his diabetes as well. So he was telling me the other day that they have brought down the scale for the diabetes when they, you know, so earlier the figure might have been different. I'm not sure about the scale itself. And then he was like that, okay, now it came down, and then now the current one actually shows that he's diabetic. So he's like, okay, I think it's the pharmaceutical companies which are playing with us. So can you please speak about
it? Because I'll start with your last question first.
Yeah,
the last point. So, yeah, I mean, like when we're talking about hypertension, there's, you know, the World Hypertension League, and then there's a Joint National Committee, you know, Session 8, which worldwide tries to harmonize the definitions for hypertension. So every year the figure comes down lower and lower and lower. Similarly, for diabetes, it comes down lower. But it's basically early detection is the key. It's, I think, not everything is a play of the industry. If somebody told me that, yeah, if your creatinine was at this level, if I had a better test to detect it 2 years ahead, and I would be saved 2 years of dialysis because I would get appropriate treatment earlier, I would say, yeah, bring me on whatever test there is. And okay, lower down the scales, and I would be happy to be labeled diabetic at an earlier scale or hypertensive, considering the impact it has subsequently on the development of kidney disease. As far as the research business is concerned, I mean, you know, the Pakistan Society of Nephrology has been playing a very important role, and this year their committee and their chair has put together several task forces, including for advocacy, and research is one of those things. So our job is basically to try and train our nephrologists, trainees, as well as the supervisors in the techniques of high quality clinical research, and subsequently hope that by the end of the year we put together networks within the country which can generate our own data to inform evidence-based policy formulation.
Exactly, and we certainly need it, and the world's actually talking about it as well. And you were very wise with your words, sir, when you actually kind of defended the pharmaceutical companies, that it cannot always be the pharmaceutical companies. I like your approach, and it's good. But imagine that early detection will actually put somebody on medication, and that's something which we want to avoid, rather than somebody having regular doses of their medication just because the scale now have come down. It will put a lot of people on medication, eventually helping pharmaceutical companies to sell their medicines.
Fortunately, the early detection is usually associated with early lifestyle changes.
True.
Not always it's going to be medication.
Exactly. Thank you so much. Once again, very wise with words. But now moving on to Dr. Zahid Saab over here. So Zahid Saab, now God forbid, when we speak about all of those chronic illnesses, first of all, when do you think that the gentleman or the lady really needs to show up with their symptoms? What can be the early symptoms for people? Obviously, we've spoken about protein in urine and all of these things as well, and the fluid and pathri, God forbid, or the kidney stone. And God forbid, if you think that it's not or it cannot be helped with medication, then when do you think it's the time for kidney transplant?
Yeah, two things. One, I would like to emphasize, because unfortunately many of the kidney diseases they don't have so many symptoms in the earlier part.
Okay.
So that's why initially I said if you are a high risk person, you should check.
यानी घर में किसी को है तो आप check करा लें.
Yeah, if you are diabetic, hypertensive, as sir mentioned, you are diabetic more than 10 years, type 2, there's a chance that kidney might be involved. So a check at the right time is very important, because the symptoms, most of the glomerular diseases, there might not be any symptom, and patient is presenting for the very first time with full-blown symptoms, and you found that the kidney is gone.
Right.
And what tests are available to kind of go ahead and
Dr.
check
Quadri mentioned, I think the most important test which is undervalued is the urine analysis.
Okay.
Right.
It is very cheap. If you are at risk, just do your urine analysis, and if you can just complement it with the ultrasound of the kidneys, I think these two tests will give you ample information from where you can further decide what is the way to move forward. So these two tests, and obviously RFTs, which is a kidney function test. If you do these three tests, you would come to know if there is something seriously wrong or no.
Okay.
Right.
Sorry.
Yeah, please.
The other thing is that you asked about dialysis and transplant.
Yeah.
Transplant we offer to the patients once we are sure that their kidney is not going to function. There are two ways we offer transplant to our patients. Once we have ascertained that it's a chronic kidney disease, it's an irreversible phenomena, so they are under our follow-up, so we offer them a preemptive transplant so that they should not hit the dialysis machine, and we can transplant them before that.
Okay.
The other population is which unfortunately presented late. They are already on dialysis, so we label them as end-stage kidney disease, and they are dialysis dependent. So the best option for them is transplant by all means.
Okay.
And
Right.
unfortunately in Pakistan, it is not been offered to patients for multiple reasons. The doctors themselves are not well exposed to this. They are not well exposed because many of the hospitals, even in Pindi, Islamabad, they are not doing transplants.
Right. Okay.
So those who have been trained there, they have not been exposed to this. So they don't offer this to the patient. But if you review the literature, the data, sir is a researcher, he will tell you that by all means, transplant improves your survival.
Right.
Your 1 year survival, your 5 year survival, your 10 year survival. And diabetics, one thing I would like to add, diabetics, they are not usually being offered transplant saying कि जी वो आपको तो sugar है ये तो transplant हो ही नहीं सकता. Transplant is the best option for diabetics. If you are a diabetic, you have reached end stage kidney disease, the chances that you will survive 5 years is only 30%.
Right.
But if you are diabetic, you get a transplant, you were a dialysis patient and you got a transplant, your survival is 80% 5 years.
Oh, wow.
So the transplant is a real magic, I think, and we should promote it by all means.
Right.
Wow.
Now, Dr. Mujtaba Quadri Sahab, sir, I wanted to ask you, like, how much of the medical nutrition therapy is effective in the slow progression of the chronic renal disease? And also, I want to ask this question because I feel it's very important. The people who are going through or suffering through kidney diseases, are they prone to other diseases also?
Yeah, so let me again start with the last one, because at my age I remember the last question first. So the last question, what was the last question? I'm sorry.
The people who are suffering through kidney disease are prone to the other
Other
diseases also.
yeah, yes, thank you so much. So yeah, I mean, like unfortunately, because a lot of patients with kidney disease have accelerated atherosclerosis,
Right.
the biggest killer in our population is heart disease and strokes. So these are the ones. So you need to be very careful in terms whether you are diabetic or not. Even if somebody has proteinuric states, a lot of protein in the urine, they have a tendency to develop hyperlipidemia or high cholesterol levels and all. So they have this atherogenic medium which causes stiffening of the vessels of the heart or the brain.
Right.
So they are more susceptible to that. Their patients on dialysis, they don't have very good immunity. Patients who are transplanted don't have very good immunity, susceptible to infections of all kinds, unusual infections, opportunistic infections, we say. So yes, I mean, like obviously if you have kidney disease, it doesn't come alone.
Right.
Unfortunately, a lot of things come with it. A lot of metabolic problems, bone disease, all those things, anemia, it's all part of the system.
Right.
Because the kidneys are master brains, so to speak, peripheral brains in the body.
Understood.
Now, when you're talking about the first question, you were talking
Medical
about
nutritional therapy,
yeah,
is
the
it
nutritional
effective?
thing. So yeah, I mean, like dietary therapy and nutritional therapy is one of the most important strategies to delay progression of chronic kidney disease.
Right. Okay.
That's why it's so important to have an approach where anyone who has chronic kidney disease and they have so-called glomerulonephritis, they're the ones who are salt retainers. So they need to have salt restriction usually. Fluid intake, there's a misconception that you give lots of fluids. That's not appropriate for patients with chronic kidney disease. They cannot get rid of a water load, so about 1.5 liters a day.
Right.
More than that hurts, less than 1 liter a day hurts. They need to have special diets where they restrict their potassium intake, they restrict their phosphorus intake, and the protein intake. If you reduce it by about 20 to 30%, that has a salutary effects in terms of delaying progression of chronic kidney disease. So nutritionists within the team are extremely important to have, and patients always seek advice from nephrologists or urologists, but they also sometimes need to go specifically to target their food food preferences.
Right.
with the intakes
Wow.
that are recommended.
That's wonderful. Thank you so much, Professor Dr. K. Mujtaba Quadri Saab, consultant nephrologist, Maroof Hospital as well. And thank you so much, Professor Dr. Zahid Nabi Saab, head of nephrology, KRL, for joining us, and that too on such an important day. And for everybody who's out there, ladies and gentlemen, with that, we certainly need to head out towards the short break, but don't go anywhere, because when we come back, we have another fantastic segment for you. But before we go there, please make sure that you look after your kidneys. It's really very important for your well-being. For all of those people who are hypertensive or diabetic, please make sure that you look after yourself in the first place, get yourself tested. And I always recommend this, that at least once a year or twice a year, please make sure that you just get yourself checked up, even if there's nothing wrong. There's no harm in it. With that, we're heading out towards a short break. Don't go anywhere. We'll be right back. Good morning.